Well, you know what? It's my absolute pleasure to welcome Dr. Abhi Thakkar, a medical professional known not just for expertise, but for genuinely listening, educating, and empowering patients. He's a nationally recognized dental health care expert and serves as a clinical dental director at a community health center, Camarana Health, in California. In addition to caring for patients, Dr. Thakkar helps train future dentists and works with schools, community groups, and public health partners to improve oral health for children and adults alike. इनका जो काम है, his work centers on making dental care easier to understand, more preventive and accessible for everyone, and today he'll be helping us understand how everyday habits can make a big difference for our teeth and overall health. Good morning, Dr. Thakkar. How are you?
Good morning. I'm doing great. How are you?
I'm doing great. Thank you so much for asking. So, Dr. Thakkar, without wasting any more time, I would like to ask some questions on behalf of our listeners.
Awesome.
Okay.
Yes.
So, generally, वैसे भी कहा जाता है कि oral health, oral dental health is very important. But I want to know that why does oral health matter during pregnancy?
That's actually a really great question and great topic for today, I feel, the pregnancy and oral health, right? The reason is because during pregnancy, your body goes through many changes that can affect your mouth. Now, hormones can make your gums more sensitive during that period, and it's really easier to swell or bleed.
Right.
If bacteria builds up in the mouth, then it can cause gum problems or infections. And if these infections in the mouth are not treated, they can affect your overall health. So again, mouth infections do not really just stay in the mouth. They can affect your whole body and overall health. And that's why maintaining overall and oral health during pregnancy supports maternal, meaning mom's health, and long-term child oral health as well.
Right. So, Dr. Thakkar, कई बार लोगों को ये रहता है कि भाई पता नहीं, will it be safe enough to go to a dentist in pregnancy? So, what do you have to say for that?
Absolutely, this is a great question क्योंकि मैं काफी बार जब भी लोग avoid करते हैं pregnancy में जाने के लिए, but I usually and always say, literature says that it supports that absolutely it is a safe thing to do, and dental treatments, they do not need to be withheld during pregnancy because when proper risk assessment is performed, you should be good. Now, dental treatment may be modified in timing or techniques, but the routine and necessary procedures like including treatment of pain or infection, everything is considered safe because the benefits outweigh the risks, right? And that's why avoiding treatments can actually pose greater harm to the mother than providing appropriately planned dental care.
Right. But कई बार होता है कि a dentist will say कि भाई हमें X-ray करना पड़ेगा. So is that safe during pregnancy?
Again, absolutely safe. Yes. Studies do support and show that modern dental radiography uses extremely low levels of radiation that are far below the threshold that can cause any harm to the baby. Whenever radiographs are clinically justified and protective measures are taken, like lead approaches are used, then there's no scientific rationale to withhold the dental X-rays during pregnancy. So they're absolutely safe. किसी को चिंता की बात नहीं है.
अच्छा, तो ये बताइए कि is there any particular trimester which is the best time for dental treatment during pregnancy?
Best time for the dental treatment during pregnancy, I would say the trimester, right? It really matters. 14 to 28 weeks. Second trimester is the best trimester and safest and most comfortable time for routine dental care. But because actually for any treatment and any infection, let's say a patient has an infection, mouth swelling है या दर्द हो रहा है, you can go at any point of time. पर अगर आप मुझसे पूछो कि कौन सा सबसे safest time है, तो 14 to 28 weeks, that is the second trimester, that's the most safest week. The reason is because morning sickness is often better, and it is the easiest time for routine dental care because the patients feel more comfortable and in the chair as well. And in the early third trimester, routine care may still be provided, but during late third trimester is when we usually limit our treatments due to patient discomfort and risk of a syndrome that's called as supine hypotensive, जिसकी वजह से किसी को चक्कर आ सकते हैं या dizziness हो सकता है, ठीक नहीं लगता है कभी चेयर में. But that said, pain or infection should be treated at any time during pregnancy. But अगर आप उससे पूछो कौन सा सबसे safe time है, so 14 to 28 weeks, that's the second trimester.
Awesome. So, Dr. Thakkar, we'll take a musical break and then I'll come back to you and ask a few more questions from you.
Absolutely. Thank you so much.
The Dill of Dallas. Heart to Heart, Funasia.
So today on the show, we have someone who truly believes that good health is the foundation of a good life. Dr. Thakkar, are you there with us?
Yes.
Awesome. So I have few more questions before I let you go. तो मुझे बताइए कि जनरल आप चेकअप और क्लीनिंग तो ठीक है, but what about अगर आप pregnant हैं, then are dental cleanings, fillings and root canals, are they all safe during pregnancy?
Yes, absolutely. हर तरफ routine dental procedures, including cleanings, fillings, root canal therapy, extractions, मतलब दांत निकालना, everything is considered safe during pregnancy. जो anesthesia देते हैं, which is commonly called as lidocaine dentistry में, और वो भी classified as safe when administered properly with aspiration. And कोई भी actually leaving infection untreated will pose a greater risk than the definitive dental treatment.
Right. मतलब जितनी जल्दी पकड़ में आ जाए उतना अच्छा, right?
बहुत important है, yes.
अच्छा, दूसरा मुझे ये बताइए कि when one goes and if somebody is pregnant, even early in pregnancy, should they tell the dentist that they are pregnant?
Yes, they should. Informing the dentist as early as possible actually वो अच्छा रहेगा क्योंकि वो अच्छी तरह से appropriate medications care दे पाएंगे dentist. Your dentist needs to know because they will be taking x-rays with extra protection, precautions लिए जाएंगे about how you will be positioned in the chair. And that's why knowledge of pregnancy status allows us as dental team and providers to prevent complications such as hypotension, जैसे मैंने पहले कहा था, and we can tailor medication use appropriately and again coordinate care with patient's physician as well.
Okay, and then Dr. Thakkar, बहुत सी myths होती हैं around dental care, around pregnancy that people, have. So I'm sure you would have come across many of them. Would you like share that what are these myths and they should stop believing them?
Oh yes, that's all. But the biggest myth is that dental care is unsafe. और काफी लोगों को ऐसा लगता है कि मैं pregnant हूँ तो मुझे नहीं जाना चाहिए क्योंकि problems create हो सकते हैं मेरे लिए. But nothing is unsafe. The literature clearly states that unnecessary avoidance of treatments due to the fear of baby harm is misguided. And properly planned dental procedures and medications are absolutely safe. While अगर आप dental problems है या infections है, अगर आप treat ना करो, it may worsen and pose greater risks. And then the truth is that, avoiding dental care is more risky than getting it, right?
Right.
So that's why dental treatments are absolutely safe. In fact, untreated infections are not.
Right. And then Dr. Thakkar कहते हैं कि when you're pregnant, you shouldn't be lying flat. So why do dentists avoid having pregnant patients lie flat in the dental chair? Like, I hope they are aware, and if not, the patient should be aware of this.
Yes. Later during pregnancy, क्या होता है कि when you lie them flat, dental chair में, so the baby can actually press on a larger vein called as inferior vena cava that helps the blood go back to the heart. तो हार्ट की तरफ जो ब्लड जाता है उसके ऊपर वो पुश होता है बेबी की तरफ से if you lie them flat. So that's why we keep our patients slightly tilted for their safety, and this will reduce the venous return to the heart. And the problem of lying flat is that it can reduce the venous return to the heart, and it can cause the hypotensive syndrome that I was mentioning about before, जिसकी वजह से शायद vomiting हो सकती है, dizziness हो सकती है, आपका hypotension हो सकता है उसकी वजह से. But to prevent this, हम क्या करते हैं? We position them semi-reclined with a slight left lateral tilt. मतलब आपका right hip हल्का सा थोड़ा सा ऊपर जाता है लेफ्ट की तरफ. And that's the actual way where we position our pregnant patients, and that is the most safest way to treat our pregnant patients whenever during that period. Because lying flat, I would say, could cause this kind of unnecessary problems. Yes.
All right. And Dr. Thakkar, last question before I let you go. Can dental problems during pregnancy affect the baby's health or pregnancy outcomes?
Yes. So research has shown that there is some associations and possible links between mother's gum disease and adverse pregnancy outcomes. And again, I'm saying possible links because there's no evidence कि होता है, but there's some possible associations, right? But while this relationship is multifactorial, बहुत सारे factors हैं इन चीजों में and influenced by many variables. But I would absolutely recommend controlling your gum inflammation during pregnancy is considered more beneficial than anything. So please go to your dentist, consider it safe, and they will take care of you and your baby.
Awesome. Well, thank you so much, Dr. Abhi Thakkar. I'm sure our listeners are walking away more informed, more confident, and more inspired to take better care of themselves. Once again, thank you for sharing your knowledge and your time with us. It was an absolute pleasure having you on the show, and I do hope to have you back very soon.
Thank you so much for having me on this show. I really appreciate the opportunity and to be a part of this important conversation and to share insights on oral health with your listeners. Thank you.
Thank you.
Have a good day.
You too. Bye-bye.
The Dill of Dallas.